Hi there, and welcome to Coast Dental. I'm Taylor Wallace, the Infection Control Coordinator for this practice. First, let's look at where our hand sanitizers are placed and stored. Here, in the entrance, we have freestanding dispensers for patients to use. They are motion activated. We also have a dispenser in the reception area for our patients and staff. We keep them furthest away from electrical outlets because of the hand sanitizer's 60% alcohol content. As we go further back into the operatories, there is one 8 fluid ounce bottle stored 4 inches into the op, and each of these are noted in the fire plan located in the front office. We then have replacement bottles kept in approved flammable marked liquid storage units in sterilization. This is a warning sign for flammable objects, including chemicals.
Attention all staff, code red. Smell of smoke coming from the break room. Please follow fire prevention plan protocol.
Let's take a look at the layout of our facility. There are 3 exits we can take. We want to choose the one farthest away from suspected or potential fire. Here's the best exit for staff in the back. Staff are to safely stop their work to assist in evacuating patients. Reception area will dial 911 and request an ambulance once everyone has been evacuated. Our hygienist, Sarah, has been assigned to turn off all sterilizing equipment. Our dentist, Dr. Peters, is tasked with turning off all mechanical operations, including the compressor and vacuum. Once they've done their duties, they will immediately evacuate and we will all convene at the street corner of Brooks Street and Maple Avenue. I will then conduct a head count and inspect the sign-in sheet to make sure everyone is accounted for. In the case of a missing person, I will inform the officials of the missing person's name and their last known location. Since we are 3 blocks away from a hospital, we have an office cell phone that speed dials a pre-recorded message to them. Within 3 to 4 minutes of the incident, I, along with the dental assistant, Rebecca, have been delegated to perform BLS if so required. Our office manager will have grabbed a first aid kit for minor injuries. After the firefighters have arrived, we will call HR and the other dentist on staff and recall the events that have occurred. This was only a drill, but there are preventative measures we have in place at our facility in the case of a real emergency. As you can see, there are many hazards that may lead to a fire. Electrical outlets, chemicals, Bunsen burners used in the lab, oxygen tanks, and so on. The graphic used to indicate potential dangers are called hazard communication pictograms. Flame, gas cylinder, exploding bomb, oxidizers. Be mindful of these and store in a cool, dry place to avoid a reaction. Keep a tight seal on chemical containers. Be mindful of heat-producing equipment that may produce sparks. When it is time to dispose of materials, make sure the flame is extinguished and the material will then go to our state-approved solid waste facility. Our building hosts 2 fire extinguishers and a sprinkler system. Respirators and masks can be found in storage. We have an outside company that ensures our exhaust hoods in the lab are in excellent working condition. If chemicals become expired, we have a separate chemical disposal company that handles that. Their number is listed in the directory next to our safety data sheets. Our employer handles that. Wash stations are located in the lab. Dr. Peters is in charge of making sure they are in operating condition. Greg, our lab tech, is responsible for monitoring fuel sources such as oxygen tanks, natural gas, propane, and butane. When working in the lab and sterilization, it is important to note where all the chemicals are stored and what kind of reactant they are. The list is in alphabetical order and was created by me, not only the ICC but the HAZCOM coordinator as well. What can I say? I was just born to coordinate. These lists can be found in drawers of every room. Once you are employed, you will be trained and informed annually of chemical hazards present, proper preventative measures, and be informed of post-exposure and accident procedures. That concludes our brief overview of Coastal Dental. I'm Taylor Wallace, Infection Control Coordinator, Hazards Communicator, RDA.